Hey, it's Dr. Frank from Integrative Dry Needling. I just got done reading a letter to the editor, and essentially what it was is about pneumothorax as a complication of dry needling technique, so I felt compelled to speak to it. Interestingly, it comes out of what appears to be emergency room doctors in a hospital in Belgium. And briefly, they had four female patients show up to the ED post-dry needling pneumothorax. None of the people had any medical history, but they were all being treated evidently in these outpatient clinics for left shoulder, trap, and neck pain. There were three PTs involved, and there was another practitioner they didn't cite as what it was. But they all presented to the ED with thoracic pain and difficulty breathing. And the part that was interesting is the clinical examination, as well as the vital signs, all were reported as unremarkable. It wasn't until they did a X-ray and ultrasound to really get the diagnosis of pneumothorax. Two of them were managed like normal, basically rest and oxygen. The other two needed needle aspiration, but all four of them recovered fully. Now, the conclusions they had are the part that I'm a little bit, in disagreement with. Essentially, they said our series suggests that post-dry needling pneumothorax is more common than is actually reported in the literature, and that they believe with the rising popularity of it that we're going to see more of this. Now, of course, anything can happen with it, but at least in the available information that we have in this particular one, and this is one Boyce was done in 2020, this is our most recent larger scale of over 20,000 treatments, and then we had one certainly in 2014 with Brady. All of you should be aware of this research, and this is what we use as a reference at the current point. But essentially it says that, in trained hands, dry needling is extremely safe, and we'll come back to that. The other conclusion that they had is that informed consent should be provided to the patient anytime you're going to be needling, and that pneumothorax is in fact a risk factor. We agree with that 100%. So this article was done. Essentially, it was a nominal group technique, sort of like a modified Delphi study. And Dave's one of our IDN instructors, and he did it with this group of individuals. And essentially, what we did was being able to come out and say what should be put into a really good informed consent. And if you notice right off the bat, pneumothorax is actually there. So those of you that are RDN, are part of IDN, have this already in your dashboard, and this is in a Word document. You can just change the wording. I wouldn't change any of the square because this is what the results of the research project were. But this provides a really nice outline, and it should be the one that's being used as that informed consent because, again, agreement is that people should be aware of all of the risk factors that are there. So summing this up from a clinical relevance standpoint, pneumothoraxes can occur, there's no doubt. They can occur for a number of reasons that aren't necessarily needling. But if they do happen as a result of needling, they're usually clinical error, right? A clinician has made an error. And maybe that's poor understanding of the anatomy. Maybe that's just poor training that they had. So when you're going to get training in any type of needling, you want to make sure that the group has a very specific protocol, safety protocol, and you really understand the neurology and leverage the neurology so you're not putting yourself in situations where you can get the patient in trouble, things like between the shoulder blades and such, right? And then lastly, I want to completely disagree with their conclusions that pneumothorax is more than a rare occurrence. This study was done in a very limited pool of 4 people. It was done in a very limited area, which is in and around this hospital in Belgium. So I think really the bottom line here is in trained hands, dry needling is an extremely safe and effective tool for addressing musculoskeletal conditions. All right, take care.